Hello and good morning. First, I would like to thank the organization committee to invite me for such a good meeting. Today I will try to talk about surgical management in endophthalmitis. Firstly, we have to know what is endophthalmitis. It is a severe inflammatory process that mostly develops secondary to infections and involves intraocular tissues. From where these infections coming to eye, there could be two sources. If your source is exogenous, it means you did an intraocular surgery or it has been exist after trauma. If the source is endogenous, it means there is an infection focus in the body. Here we are seeing the most common cause of endophthalmitis according to EVRS study. As we all know, the first and the most common cause is anterior chamber surgery. The second one is intravitreal injections, then the pars plana vitrectomy, and the other with eye surgery is coming after vitrectomy. The most common risk factors for endophthalmitis which exist after surgery can be collected under 5 items. Failure to clean the surgical field, prolonged surgery time, surgery performed by inexperienced physician, improper wound repair, and posterior capsular rupture or vitreous loss. The diagnosis in endophthalmitis is mostly being done by taking samples from anterior chamber or vitreous. We have two different treatment approach in vitrectomy in endophthalmitis. One of them is intravitreal antibiotic, and the second one is vitrectomy. Also, some authorities using systemic antibiotic, but there is no significant evidence about the benefits of these drugs. But there is some study they are recommending to use fluoroquinolones as a helper for systemic therapy. And another point is usage of steroids in endophthalmitis. This is a big question that hasn't been answered certainly. EVRS and ACRS recommend usage of steroids after vitrectomy, but they have no suggestion about intravitreal usage of steroids. When you check the literature, you will see lots of different results about steroid usage. I always using them during the surgery and after surgery, and I can recommend. We can talk about antibiotherapy for more time, but our topic is surgical management. So also my first choice in endophthalmitis doing vitrectomy. So why we are choosing vitrectomy? Elimination of favorable environment from microorganism, extraction of proliferating dense microorganism, emptying sequestrated abscess pores in the vitreous, increasing the diffusion rate of antibiotics, and protecting the retina from the inflammatory and toxic effect. We will do vitrectomy in endophthalmitis, but when there is a study which has been published in British Journal in this year, they are recommending to do early vitrectomy for endophthalmitis. Now I will show you another paper which has been published in EGO last year. The same recommendation has been done also by them. If you take your decision to do vitrectomy for any endophthalmitis cases, you have to follow some steps. There is some crucial steps that you have to do in endophthalmitis surgery. First, you have to insert the trocar properly. Then you provide a clear cornea, clean the anterior chamber membrane, remove the lens if it is needed. It is needed. It is not mandatory for all endophthalmitis cases. Start with anterior vitrectomy. Clean the vitreous body, which is in front of your infusion line. Remove the vitreous. Induce the posterior hyaloid. Also, this one is not mandatory. If you can do it, you can force. Clean the vitreous base by shaving and attaching. You have to attach the retina and fill the eye with the suitable tamponade. Now I will try to show all these steps by shortcut videos. Now you are seeing how we are inserting the trocars. First, inferotemporal quadrant and infusion trocar, then the second and the third. Here I want to take your attention for a sign. I couldn't show it from here, but you can see the vitreous reflux from the first trocar. It is a very important sign. It means that you are in the vitreous cavity and you can go on with your surgery in safe. The second one is corneal debridement. This is also another endophthalmitis cases. We couldn't see any details from the anterior chamber, but after peeling the corneal epithelium, you will see how the weave is increasing and your surgery becomes so easy. So this is a very easy step, but very crucial one, in my opinion. The other one, removal of anterior chamber membrane. By just one maneuver, you are seeing that the weave is becoming perfect. Another one is lens removal. This is a young patient who is suffering with endophthalmitis after penetrating eye trauma. First, we are dyeing the capsule and trying to do an anterocapsulorhexis. It is a difficult step in endophthalmitis because these membranes and reaction is making the anterior capsule very stiff. After doing anterocapsulorhexis, we are removing the lens with irrigation and aspiration. We are not using phaco because it is very young patient. It could be done by this way. Another one, also we can remove the IOL if the case is postoperative endophthalmitis. We can remove the IOL. Here I am folding the lens in the eye, then I am taking it from eye by my other hand. After all these steps, we have to do anterior vitrectomy because it's preventing you to weave the retina. I am starting anterior vitrectomy from pars plana, but there is a thick membrane behind the iris. Because of that, I am coming to anterior chamber, and sometimes I am going behind, sometimes I am coming front. After a sufficient anterior vitrectomy, you can see how the retinal weave is comfortable. The next step is posterior hyaloid detachment. Now we are inducing posterior hyaloid detachment. It is a very easy one, but as we all know, in endophthalmitis cases, sometimes it could be impossible. At that time, you don't have to force it. You can leave it. After posterior hyaloid, the next step is vitreous base shaving. In endophthalmitis cases, usually the pupil size becomes so smaller because of the infections and inflammation. So if you want to do an effective vitreous base shaving, you have to do a deep scleral depression. This is a good example for this one. We are just keeping our vitrectomy probe around the center, but the sclera is coming to us. I'm jumping one step and coming to endoiridectomy. Usually we are using silicone oil as a tamponade in endophthalmitis, but we are not putting a lens. In this case, also we did it, and to prevent any silicone oil in anterior chamber, we are doing an endoiridectomy. I am performing it from pars plana, but you can also do it from anterior chamber here. And the last step, attaching the retina and filling the eye with the suitable tamponade. It will be my last video in this session. So we will see all the steps in this video. We have already inserted our trocars. Now we are peeling the corneal epithelium. The weave is increasing, as you see here. Now I am realizing that there is a membrane. I am removing the lens, membrane, and weave becomes nearly perfect. Then I am dyeing the anterior capsule and trying to do an anterocapsulorhexis. It is a very difficult step, as I told before. Sometimes it could be impossible because of the thick anterior capsule. At that time, you can use your vitrectomy probe. You don't have to force it by another tool. But we achieved here. He is a young patient, and we are doing lens removal by irrigation and aspiration, and we are doing vitrectomy. But you are seeing here a retinal detachment. During the vitreous base shaving, we are realizing that there is a detachment. Because of that, after finishing our vitreous base shaving, I am doing a retinotomy here. Then I am filling the eye with perfluorocarbon and attaching the retina by air fluid exchange. Removing all this perfluorocarbon, I am doing laser around the retinotomy site. I don't know what is the cause of the retinal detachment. Because of that, I want to be in safe side. Because of that, I am doing 360-degree barrage laser. And after finishing barrage laser, also your surgery is almost finished. And here, as you see, I am filling the eye with silicone oil. And I didn't put any lens, and I'm closing the eye with my sutures. My take-home message about my presentation is, even your mission is so difficult, it is not impossible if you can provide a suitable environment and apply all the steps properly. Thank you.